Alright, so the topic I'm going to be talking about is suicide. Alright, so the definition of suicide is deeply unhappy or depressed and likely to commit suicide, or in other words, take your life. Some signs and symptoms. Suicide can occur from many different emotions. Some signs include long-lasting sadness, mood swings, and unexpected rage. Also hopelessness, which is a feeling, a deep sense of hopelessness about the future with little expectations that circumstances can improve. Withdrawal, choosing to be alone or in avoiding friends or social activities. And warning signs. 50 to 75% of those considering suicide will give some sort of warning sign, either through a letter or through verbal communication. So here are some statistics. The annual suicide rate is 13.2% per 100,000 individuals. On average, there are 121 suicides per day. Males account for 7 out of those suicides, which is weird because females are more likely to suffer from depression, and now almost 50% of all suicides are caused by a firearm, and the highest rate of suicide is in middle-aged white men. Prevention. Currently, there's only one medication, clozapine, approved by FDA for suicide risk reduction in patients with schizophrenia. There's other medications such as antidepressants, atypical, and lithium that has reduced death by suicide. Therapy is an option to help treat suicide. And lastly, there's this thing called the suicide hotline, and what it does is once you call, text, and FaceTime the suicide hotline, a skilled professional will answer the phone. They will learn your situation and intend to help. So the cost. The exact cost is unknown because every case is different, every therapist is different, the pharmacies can have different prices for medication, but in other words, suicide is no joke, so there's always going to be someone willing to help. Some causes of suicide. Nearly 90% of suicide, the person has a mental illness at the time of death. Depression is a top risk factor, but some mental illnesses contribute to suicide, such as bipolar disorder and schizophrenia. Other factors include previous suicide attempts, substance abuse, incarceration, family history of suicide, and being socially isolated or a victim of bullying, and also a traumatic event like a car accident or the death of a loved one can also cause suicidal thoughts. And lastly, help. As stated previously, help can come from the suicide hotline. However, it can come from your closest friends, family, or even a stranger. You never know who will help and who won't, but don't be afraid to ask for it if help is needed.